Hi, folks. Could everyone take a seat? We'll get started with our final presentation here. We're so fortunate to have Dr. Jeff Koplan with us today. Well, we always have Michael. We're fortunate to have you, but we always have you, so it doesn't seem as special. We've got a great format for this as well. This is going to be I guess we don't have a fire, but we could call it a fireside chat. It's going to be an interview format, and we're going to invite everyone to ask questions. Michael is going to briefly introduce Dr. Koplan and ask a few questions to get us started, and then he'll open it up to the audience for questions. Please don't be shy. This is a great chance to really ask Dr. Koplan something you want to know the answer to from a very big picture perspective. So without further ado, I'll turn it over to Dr. Eriksen.
Thank you, sir. So this is our special event, first research day at School of Public Health. Looks like it was a great success. And I want to thank Jeff for joining us, coming down to share his perspectives on public health and where it's been, and where it's at, and where it's going. And we want to have very much of a conversation with the audience. So I have some questions I'll ask, and Jeff may have some questions for you. Can you hear this better? Okay. So we'll have a dialogue and conversation. There's a mic that'll float around. If people have a question, you can raise your hand and things like that. And, you know, Jeff and I have a tendency to reminisce, and we're going to try to avoid not boring you with stories from the last 30 years, but talk more about contemporary public health with a focus on how it's changed, where it's at, and where it's going. And I think couldn't have a better person than Jeff to have that discussion with. You know, you all know that Atlanta's a hub of public health, probably the public health center of the world, really, in terms of expertise and institutions. And there are not people like Jeff, but there are people here in Atlanta who have really unique experiences in public health. And Jeff is one of them. And I've had the good fortune of being able to collaborate over the years. Jeff is, in terms of introduction, Jeff went to Yale undergraduate, Mount Sinai Medical School, Harvard, MPH, and decided to go into public health, which is the first question, Jeff. Why is that? You're well trained as a clinician, but you decided public health as a career as opposed to clinical medicine.
Thank you. First, let me just say it's an absolute pleasure and honor to be here. This is a great event, amazing turnout, I'd say probably about 30 times the number I thought would be here for this time. But you're welcome. If things get tough, you can leave, whatever you want to do. There's a big pile of meatballs over there, so that's great. I think it probably the short answer is, and you should remind me to give the short answers to everything, but the short answer is I had started my training in internal medicine at Mount Sinai at Montefiore Hospital in New York, and enjoyed it, respected the physicians that worked then there, the severity of the diseases, all that was of interest to me. But that magic thing didn't click. And I came to CDC for 2 years for the Epidemic Intelligence Service. And in the course of that, my first boss was a guy named Bill Foege, who was later director of CDC, and a number of other incredible folks, a guy named Stan Foster, who was a great epidemiologist. But the names may not mean much, but what it was I thought, when I was doing hospital rotations, it was great. I enjoyed it. It's important, but it didn't click that that's the way I wanted to spend the rest of my professional career. 2 years of epidemic intelligence service, that's it. That's what I want to do. That's what I want to be when I grow up. And so my first assignment was smallpox eradication in Bangladesh. And it was the exact mixture of things that I enjoy and try to do right to this day, which is it was a mixture of biomedical science, clinical issues, but also very much anthropology and sociology, cultural differences, and the issue of inequities and disparities from the get-go. Those are what are woven through public health, and with that, I grab that fabric with all that wrapping in it.
Thanks, Jeff. And just in terms of the fuller introduction, those of you who don't know Jeff, he mentioned, if we had slides, I had some slides of Jeff from Bangladesh days, rowing a canoe with a beard down to your waist, going to different villages. But his career really was instrumental in CDC. He was the first director of the National Center for Chronic Disease Prevention and Health Promotion, became director of CDC, and then became the founder of the Emory Global Health Institute for the last, 10 or 20 years has been doing that. And in those capacities has worked on a variety of public health problems that are quite wide-ranging. So I'm going to ask him a question, but then turn to you all for you to probe a little bit. But, smallpox is a good example of starting. The only disease that's been eradicated through vaccination, God forbid, reminding people about why we vaccinate people. Early on, and you can comment, Jeff was either volunteered or sent to Bhopal, India, when, if you remember, there was a chemical outbreak at a factory in India that killed many people and was a huge public health problem. Jeff was very involved with 9/11 response and bioterrorism and the anthrax, and now is very involved with child mortality in Africa, understanding and preventing that. So his career is like me. I'm kind of more focused in one area. I've done tobacco primarily for most of my career, but Jeff really has been at the center of infectious disease eradication, environmental hazards, bioterrorism, leadership of the premier public health agency in the world, and starting probably the largest funded global health institute in the world at Emory, with support from primarily the Gates Foundation. So he has a career that spans a lot of different public health problems and challenges that some of you may be interested in. So the question for Jeff is, just say a word about your greatest disappointment or challenge that you had in these experiences.
And leave out elections from this. Yeah. First of all, it's kind of you to mention all those things, and I did do them, but my conclusion is the guy's a dilettante. But one striking thing that I found in public health, and it's time at CDC and now at Emory, and it probably would be, if I were here, it would be the same thing, is a series of opportunities, some of them global threats, some of them more localized, but that when each one is done, you say, I'm not going to be able to beat this. This was just the best damn thing I ever was able to do. And then something else comes along and, oh, that's even better than the thing we did before. Or they're all great, but it's what encourages you to continue your career, and it encourages you to do well in it. And it's a further argument for you all have chosen the right career and the right degree at a great place to do it. So that's terrific. So, being part of a program in which you're eradicating a disease for the first and maybe only time, you walk away from that, and then you're in a country that you learn about by being there and make inroads in learning the language and culture, et cetera. You say, you can't beat that. That's just great. Of course, and then your next assignment is for 2 years in the Caribbean, and where we did epidemiology and field work and the whole Caribbean region, and that's a tough one to beat. Any place where in your briefcase when you're going to an outbreak, you throw in a bathing suit and goggles in case you get stranded and where you're going to be, that's not bad, not a bad locale. And so, and our whole family has been affected by our time in Trinidad, where we made lifelong friends and still keep up with them as recently as yesterday as to what's going on there, where we participated in cultural